Once again, welcome to Eye on the Community. Of course, I am Sean Anthony, and joining me up next is Liz Brown, representing the Columbus City Council. Liz, how are you today?
I'm doing great. How are you today?
Good to see you again.
Good to see you always.
So let's talk about COVID-19 incentives. Uh, why now? I mean, I thought everybody was getting vaccinated. I seen a report on the news this morning that about 40, little over 40% of residents in Ohio have been vaccinated. So why the incentive of $100?
That is a great question. Yeah, the statewide average is just over 40% for vaccination rate. And here in Franklin County, we're doing a little better than that. We're over 45%, I think getting close to 50. But, when we took a look at our vaccination rate, not average overall in our county, but really piece by piece, neighborhood by neighborhood, what we saw is that communities with little wealthier folks who are more accustomed to the healthcare system, have more familiarity navigating it, confront less bias when they do access it, and have higher paying jobs, maybe with paid time off, things like that. Those communities were higher than 50%, almost 60% vaccination rates and higher. And then you look at the communities that don't have the wealthier folks in them, right? That have people who may not have a regular relationship with a doctor or a lot of history of being able to access the healthcare system, in a welcoming way. And some of our neighborhoods are at about 25% vaccination rate. And that really matters to us as policymakers, that no matter where you live in the city of Columbus, you should have access to the vaccine and be living around people who have access to it, because we're all tied together in this pandemic. We've known that from the start.
Now, you mentioned some of the areas, the more affluent areas, the percentages are higher that have been vaccinated. Can you be more specific? I know you said obviously these are poverty-stricken areas. Can you be more specific in Columbus? Which locations have the lower numbers?
Yeah,
I
well,
guess not the lowest numbers. I guess who've been hardest hit with COVID-19.
yeah, so exactly. Actually, that's the you layered on already to my argument. That's a really important piece to point out. When you look at vaccination rates, first and foremost, a lot of the outer belt communities, suburban communities, those are have really high vaccination rates, and a lot of the communities in Columbus, in our city, who do not who make on average lower wages, have the lower vaccination rate. And yet at the same time, we know that wealthier communities also didn't have as high an incidence of COVID-19 in the first place. And we know that this matters along racial lines, that Black and Brown communities were hardest hit by the pandemic in the first place for two reasons: lost jobs and wages, and actual infection rate, right? The unemployment rates for our Black and Brown communities, especially Black women, they were hardest hit when it comes to unemployment. And we know that the incidence of infection in the Latino community, for example, was 3 or 4 times in the white community. And in the Black community, the incidence of infection was twice what it was in the white community. So it really matters to pay attention to these statistics and how they're actually playing out in neighborhoods across the city. And that's one of the reasons that we initially started, which I think you and I have talked about, the Right to Recover program in partnership with the Urban League. So we were noticing, obviously, this disparity in infections between the Black and Brown communities and white folks. And so what we did was start a program that was specifically geared towards ensuring if someone got a COVID-19 diagnosis and they couldn't afford to quarantine or isolate, there was emergency financial assistance available for them through Urban League, so that they could actually take that time off of work and not lose out on those wages. So that was kind of part one of recognizing this double jeopardy that workers face. being exposed to the illness at work, but then also not being able to afford the time off when they contracted the illness. That program was really successful. We served 1,000 workers in Columbus. 80%, almost 80% of the recipients were people of color. 62% were African Americans. Then, now we're kind of entering this new phase of recovery where focus is shifting from testing to vaccination, and improving vaccination rates neighborhood by neighborhood is the fastest, most effective way to make sure everyone can be protected from COVID-19. And because we know it's harder for workers, who may not have paid time off, have hourly wage jobs in those same communities that were disproportionately impacted. That's why we wanted to make this program, it's called Vaccine Green, available for people.
Historically, Liz, and this has been a conversation nationwide when it comes to the COVID-19 vaccine. Black folks are skeptical. They're skeptical, and a couple of weeks ago, you heard the governor putting out the lottery, the $1 million lottery to as an incentive to get vaccinated. And now here locally in Columbus, it's $100 payout. What made you land on that specific number, $100, as an incentive to get the vaccine?
Well, I would say that this program is very different from the governor's, Vax a Million, which is kind of like a play the lottery, right?
Mhm.
Our program, the reason we settled on $100 is that we're trying to think of some people are skeptical about the vaccine, and I can't read their minds as to why. And we all have educated guesses, or we hear from our family members or our community members about why. But something that we also know is there are real life barriers to getting the vaccine. Even if you want it, even if you believe in it, there are barriers. If you have kids and you can't, and I had side effects the day after I got my vaccine, right? And I had, my partner and my husband and I were able to kind of split up kid duties when we felt kind of crappy. That's not an option for a lot of people, right? But
Right.
also taking the day off of work is not an option for a lot of people. So what we were doing is trying to understand the barriers getting into people's way. And that's why we settled on a $100 thing. It wasn't about playing the lottery. It was about, is money your barrier? Is taking the time off of work to do this your barrier? If it is, we've got a solution that will help you. And I want to add to that there are kind of two parts, I think, to increasing the vaccination rate. We got to educate people about what it is and why a lot of folks are choosing to do it, right? Why'd your neighbor down the street choose to get vaccinated and finally be able to hug their grandma, right? Those stories are really important. And we've actually, through public health, we've got canvassers out going block by block, neighborhood by neighborhood, talking to folks about, trying to relate these real stories and understand, help people kind of dissuade them of fears if possible. But in addition to education, we want to take barriers away. And if money is your barrier, we want this to be an option for you. So that doesn't have to be your concern. It doesn't have to be what stands in the way.
They sent me some notes here, and I'm unfamiliar with this program, so I'm going to ask you to clarify because I haven't heard of Vaccine Green. They're
Yep.
saying it's a follow up to on the right to recover. Can you tell me a little bit more about this program?
Yep. So Right to Recover was the wage replacement program in case people got infected and couldn't afford to quarantine. So it replaced those wages. It took off so people could isolate and take off time from work. So Urban League was our front door of that program, and they did a great job with it, as I was, some of those numbers I threw out there. We've now pivoted to extending that program. So I do want your listeners to know that if you're infected with COVID-19, or if you're a caregiver of someone who's affected with COVID-19 and you have to isolate and you're worried about not being able to be paid during that time, please go to the Urban League, because our Right to Recover program will be extended to the end of the year to give you emergency financial assistance so that you can afford to quarantine.
Now you,
But yeah, go ahead.
oh, I'm sorry. Go ahead. Finish up. I'm sorry.
Well, so I was just Urban League has been such a good front door for that program that we're partnering them with them again on Vaccine Green, which I can explain Vaccine Green. But I didn't know. I wanted to pause if you had a question about Right to Recover.
That was good. Go ahead. What is vaccine green?
So Vaccine Green, it rhymes. So we thought we'd call it that. I will be made fun of if that title doesn't work well. But for now, we're going for it.
Oh, so I get it. The play on the green on the
Green.
Benjamin. Okay, I get it. Okay.
Yeah, Vaccine Green, Vaccine Cash.
Gotcha.
When we can't use alliteration, we try to use rhyming, right? So anyway, so Vaccine Green, Urban League will have a website that goes live later today. It'll be something like cul.org/vaccine green probably. And that is where you can go to access $100 for getting your vaccine. And I want to emphasize that it's for anyone who, we hopefully pass the program tonight, and it's for anyone who gets vaccinated from today forward, basically. We're trying to induce future behavior, right? We're trying to help folks in the future who haven't managed to get it yet, strip away any barriers they may have to getting it. So if you're getting vaccinated or someone you know is, today or anytime in the future, you can go to Urban League to access $100 to help you make it work.
Now you've mentioned Urban League several times throughout this interview. Why partner up with the Columbus Urban League with these programs?
Well, first and foremost, they have great experience in emergency financial assistance programs. Like they have experience with cash assistance, and it takes a whole infrastructure to be able to run a really good program like that. And we trust what they do. But secondly, disparities exist in our community based on the color of people's skin. It shouldn't be the case, but institutional racism means that access to the healthcare system and access to good paying jobs often, falls off along racial lines. And the Urban League has a trusted relationship with a lot of people in our Black and Brown communities, especially our Black community. And we wanted our neighbors in the Black community to understand that they can trust the program the Urban League is offering, and the Urban League is there for them to make it work. I think that sometimes accessing benefits or programs can be an alienating process in and of itself, right? I mean, I know that from personal experience when I've had to work with an insurance company on something because my bill was wrong, or my lease on my car, there was something going on. We all have those experiences, and when you trust the person on the other end of the line, it makes it so much easier.
It makes a better experience.
Yeah. So we really wanted to go with Urban League for that reason.
So Liz, how do residents qualify for these programs?
So Right to Recover, you have to be at 185% of the federal poverty line or below. And there's a process Urban League has to really make it easy to verify, your income qualifications. So again, that's an important part of working with Urban League. They make it easy on folks to verify. So we're not.
Because I was about to pull out my calculator. Like, what does that mean?
I know. And I should be able to cite the numbers a little better than I can, but it's about, it's at 185%. So you can use, like a SNAP card or a WIC card also to prove that. Mm-hmm. And that's Right to Recover. So if you've been diagnosed with COVID and you need help meeting your bills in order to take that time off of work. Now on the Vaccine Green program, there's no income eligibility. Anyone can get it. And it's important that the front door is the Urban League, because honestly, we want the people who are getting this to be the folks who need it most. A lot of the predominantly white communities have really high vaccination rates right now. Mm-hmm. So we're not saying no to anyone, but the program, we really hope, will have an equity focus in terms of who accesses it, as Right to Recover has.
I'm just thinking before we wrap up, it goes to show, because like you were saying earlier, there are people in the Black communities in the city that want to get the vaccine, but like you said, there are barriers. It really is exposing the medical industry and the disparities that there is in Black and Brown communities.
Yeah.
It's unfortunate, but
Trust, right?
right. Lastly, Liz, what's next for the city efforts to supporting residents during this crisis?
Well, the our Columbus Public Health is still focused on getting vaccination rates up. So this program is one part of it, but also just their ongoing efforts to offer mobile clinics. So please, look out for that. They will soon be closing kind of the mass vaccination site that they have run in favor of doing smaller, more accessible vaccination sites in neighborhoods across the city. We know that the most effective way and the fastest way to stop COVID-19 from hitting our neighbors and our friends and our family is by increasing vaccination rates. That's the fastest way to get this thing gone. And so that's what Columbus Public Health is focused on, almost exclusively vaccination rates. That's the key right now.
Gotcha. Where can people get more information that's tuned in right now?
On the Columbus Public Health website for the clinics that I spoke about. And then for the Vaccine Green program or the Right to Recover program, go to cul.org. And /Vaccine Green will be the Vaccine Green program, /Right to Recover is the Right to Recover program. And again, I'll say it one more time, just so your listeners are extra clear on the options. If you are infected with COVID-19 or you are the caregiver of someone who comes down with COVID-19, and that is where the Right to Recover program can help you. Because we know that when you get that diagnosis or a family member does, it threatens your job stability. So go to the Urban League to access Right to Recover. If you want to protect yourself against this so it won't hit you or your family, and you have barriers in your way, like taking time off of work, finding childcare, all those things, go to Columbus Urban League to access the Vaccine Green program. That's how you can get $100 to make sure you can take care of those barriers in your life to getting it.
Awesome. Columbus City Council Liz Brown, always a pleasure to speak with you. Thank you so much for sharing
Always.
this information. Have a good
Thanks,
one.
John.
All
Have
right.
a good one.